and the body can do that too, but only to that normal level, that set point. But what we now know is that for a number of diseases, there are defects in the system where the body can't prune back extra blood vessels or can't grow enough new ones in the right place at the right time. And in these situations, angiogenesis is out of balance. And when angiogenesis is out of balance, a myriad of diseases result. For example, insufficient angiogenesis, not enough blood vessels, leads to wounds that don't heal, heart attacks, legs without circulation, death from stroke, nerve damage. And on the other hand, excessive angiogenesis, too many blood vessels, drives disease, and we see this in cancer, blindness, arthritis, obesity, Alzheimer's. Now I'm going to focus on cancer because angiogenesis is a hallmark of cancer, every type of cancer. So here we go. This is a tumor, dark, gray, ominous mass growing inside a brain. And under the microscope, you can see hundreds of these brown staining blood vessels, capillaries that are feeding cancer cells, bringing oxygen and nutrients. But cancers don't start out like this. And in fact, cancers don't start out with a blood supply. They start out as small, microscopic nests of cells that can only grow to 1/2 a cubic millimeter in size. That's the tip of a ballpoint pen. Then they can't get any larger because they don't have a blood supply, so they don't have enough. So the body's ability to balance angiogenesis, when it's working properly, prevents blood vessels from feeding cancers. And this turns out to be one of our most important defense mechanisms against cancer. In fact, if you actually block angiogenesis and prevent blood vessels from ever reaching cancer cells, tumors simply can't grow up. But once angiogenesis occurs, cancers can grow exponentially. And this is actually how a cancer goes from being harmless to deadly. Cancer cells mutate, and they gain the ability to release lots of those angiogenic factors, natural fertilizer, that tip the balance in favor of blood vessels invading the cancer. And once those vessels invade the cancer, it can expand, it can invade local tissues, and the same vessels that are feeding tumors allow cancer cells to exit into the circulation as metastases. And unfortunately, this late stage of cancer is the one at which it's most likely to be diagnosed, when angiogenesis is already turned on and cancer cells are growing like wild. So, if angiogenesis is a tipping point between a harmless cancer and a harmful one, then one major part of the angiogenesis revolution is a new approach to treating cancer by cutting off the blood supply. We call this anti-angiogenic therapy, and it's completely different from chemotherapy because it selectively aims at the blood vessels that are feeding the cancer. 2 years ago, I asked myself, can we take this one step further and treat other cancers, even in other species? So here is a 9-year-old boxer named Milo who had a very aggressive tumor called a malignant neurofibroma growing on his shoulder. It invaded to his lungs. His veterinarian only gave him 3 months to live. So we created a cocktail of anti-angiogenic drugs that could be mixed into his dog food, as well as an anti-angiogenic cream that could be applied on the surface of the tumor. And within a few weeks of treatment, we were able to slow down that cancer's growth such that we were ultimately able to extend Milo's survival to 6 times what the veterinarian had initially predicted, all with a very good quality of life. And we've subsequently treated more than 600 dogs. We have about a 60% response rate and improved survival for these pets that were about to be euthanized. So let me show you a couple of even more interesting examples. This is a 20-year-old dolphin living in Florida, and she had these lesions in her mouth that over the course of 3 years developed into invasive squamous cell cancers. So we created an anti-angiogenic paste. We had it painted on top of the cancer 3 times a week, and over the course of 7 months, the cancers completely disappeared and the biopsies came back as normal. Here's a cancer growing on the lip of a quarter horse named Guinness. It's a very, very deadly type of cancer called an angiosarcoma, had already spread to his lymph nodes. So we used the anti-angiogenic skin cream for the lip and the oral cocktail so we could treat from the inside as well as the outside. And over the course of 6 months, he experienced a complete remission. And here he is 6 years later, Guinness, with his very happy owner. So I started asking myself, why haven't we been able to do better? And the answer to me is obvious. we're treating cancer too late in the game, when it's already established and oftentimes it's already spread or metastasized. And as a doctor, I know that once a disease progresses to an advanced stage, achieving a cure can be difficult, if not impossible. So I went back to the biology of angiogenesis and started thinking, could the answer to cancer be preventing angiogenesis, beating cancer at its own game, so that cancers could never become dangerous? This could help healthy people, as well as people who have already beaten cancer once or twice and want to find a way to keep it from coming back. So to look for a way to prevent angiogenesis in cancer, I went back to look at cancer's causes. And what really intrigued me was when I saw that diet accounts for 30 to 35% of environmentally caused cancers. Now, the obvious thing is to think about what we could remove from our diet, what to strip out, take away. But I actually took a completely opposite approach and began asking, what could we be adding to our diet that's naturally anti-angiogenic, that could boost the body's defense system and beat back those blood vessels that are feeding cancers? In other words, can we eat to starve cancer? Well, the answer is yes.